mentioned, we've seen a poor person who needs specialized treatment being wheeled away in a vehicle which is not fit for transportation, which is not fit for transferring a very sick person. We saw how that person was hauled literally into a vehicle which is not an ambulance, yet this is a person who is bedridden. This is completely unacceptable, and unless something is done immediately, we've said we would have to move to court so that an order is issued under Article 43 of the Constitution for the governor, MCAs, and the senator to take their roles very, very seriously. The CS who said the facility is functioning should immediately resign, because looks like what he was talking about is above his paycheck. Similarly, the CEC for health and the CEOs and all the CECs, they should equally resign. The MCAs should come back from Facebook, they should come back from social media, call an emergency session in the assembly to discuss the crisis. As I have said, a needy patient, a patient who was in the ICU has just been transferred because there is no treatment that is being administered. This is a humanitarian crisis in Kericho County. An international humanitarian law epitomized in Geneva Convention would never allow a closure of the hospital, would never allow denial of emergency medical treatment, and that is why oversight, which is led by the Senator Kericho County, should seize the moment, call for a special session in the Senate of the Republic of Kenya and have a discussion on this, and a way forward is provided. And the county government of Kericho should explain to the people of Kericho and Kenyans where the 8 billion shillings received every financial year goes. Our hospitals in Kericho are the highest on-source revenue generators. They generate a lot of money compared to any other sector. Where is this money going? And doctors, clinical officers, and medics are not jokers. These are not people who are asking for unreasonable terms. The county government should discuss this. The CEC, through the intervention of the oversight of the Assembly, and the Senator should have a discussion on this, and a return to work formula is found immediately, because Kericho doesn't have a limitation of resources. We have enough resources. I've already said Kericho County government receives 8 billion shillings every financial year from the Exchequer, that is the National Treasury. We have on-source revenue, like for example the hospitals across Kericho, and therefore, considering that health is a devolved function, and considering the importance of public hospitals, Kericho is the biggest referral hospital in this county across South Rift. It's important that a discussion on the same is done, and a return to work formula is found immediately, because my inquiries earlier on have told me that all the mission hospitals across Kericho are filled up. Patients are now sharing beds. Even private hospitals are full, because patients who are here, who are in need of specialized care, cannot be attended to. And the urgency of the moment would require that treatment is given immediately. People cannot wait because they would lose their lives.
Kuna CBA ambayo madaktari wanasema amjatia sahihi. Pia clinicians wanasema amjatia sahihi. It's either mutie sahihi CBA na hospitali yetu irudi kufanya kazi, na kama hamwezi, sisi kama wanaharakati Kericho County tunasema hivi, tunawapatia siku 14, hata si siku 14, siku 5. Kama mtafanya hivyo, tutaita wananchi wa Kericho na tutaandamana. Tutasimamisha kila kitu katika kaunti hii, kwa vile matibabu ni haki ya kibinadamu.
Hii ni hospitali ambayo inasaidia kila mtu na inafaa ifunguliwe mara moja. So kama kuna jambo ambayo inafaa mfanye mara moja. Hiyo siku 5 ambayo tumewapea inatosha kabisa, sababu watu wanaumia kule nje, wananyamasia tu, lakini siku ambayo itapita ndio utajua ni nini hasa kumbe wananchi kweli wanakasirika.